Buenos dias. Nothing that Fernando said is true. I'm very honored and grateful to be here, and particularly in the company of my dear friend Fernando and Jorge, and all of the wonderful dignitaries who've come, Chancellor of the University, the President of Catholic University, Dean of Law, Medicine, Nursing. It's really a great, great honor to be here. I love Puerto Rico. I would love to do this lecture in Spanish, but it wouldn't be as good. So please forgive me for speaking in English. By the way, I thought that our moderator spoke Spanish so beautifully that I actually understood. Sometimes it's too rapid for me. I've spent, as Dean Cordero has said, most of my life in public health, and I do consider that I know public health as well as I possibly could. My son says that I talk about public health so much that I suck all of the joy out of life, which is probably very true. The last 5 or 6 years, I have spent my time working in the field of global health. And that is the topic that I want to turn. I've just finished a book on global health law with Harvard University Press, and so I've spent the last 5 years of my life really immersed in this field. And what I have realized is that amongst all of the complexity of global health, there are really 3 basic questions. And if we could answer these 3 basic questions, we would come a long way for improving the health of the world's population, and particularly the most disadvantaged. My talk is about global health with justice. I teach at a Jesuit university. The Jesuit tradition is justice and makes me very proud. And of course, from the bioethics point of view, I would say even beyond non-malevolence, I would say justice is the prevailing virtue of the field of bioethics and ethics more generally. So the 3 questions that I want to discuss with you, and that will be the topic of my talk today, are very simple. But the answers are profound, I think, and can make a world of difference for the health of the population. The 3 questions are, what would global health look like? That is, if we could achieve global health, what would it look like? I mean, we work so hard in global health and AIDS and malaria and non-communicable diseases, and do we really know when we've succeeded? And so I'm going to talk about what it takes to make a population healthy, as my first question. My second question is, if we could understand what success would look like for global health, then the next critical question is, what would global health with justice look like? They are actually very different. And then the third would be, what steps could we take to achieve a world that is imbued with global health and justice? And therefore, my title of my talk is Imagining Global Health with Justice. So let me turn to the first question. Currently, the United Nations is in a very frenetic state, trying to discover what should be in place for the post-2015 Millennial Development Goals. As many of you know, the Millennium Development Goals were formed at the turn of the millennium, and they were by far the United Nations and the international community's most ambitious program for creating social and economic development, which is really critical to health. Many of the MDGs, as they're called, related to things that are important to health. Food, for example, would be important. Reduction of extreme poverty is critically important to global health. But in addition to that, there were a number of health-specific MDGs, the major ones being child and maternal health, and the reduction of AIDS, tuberculosis, and malaria, and other diseases. There were many things that were missing from that agenda that are critically important to the world's population. One of them is non-communicable diseases, which are, we're finding that there's an epidemiological transition everywhere in the world, including here in Puerto Rico, from infectious to non-communicable diseases. Cancer, heart disease, diabetes, respiratory infections, many of which are preventable causes from tobacco, excessive use of alcohol, diet, and physical activity, all critically important. There were other things that were missing, like injuries, which take a terrible toll in low and middle income countries. And perhaps worst of all, no mention of mental health. My first love in the world was mental health. I began my career, my life, actually, when I was the head of the National Association for Mental Health in the United Kingdom. It was sad to me that there's been so little progress and attention in the mental health area. By the way, I met my dear wife, we're still married to, Jean, at the National Association for Mental Health. So both Jean and mental health were my first loves. In that order. So the MDGs were important, but they left a number of things out. The other thing they left out is an article that I'm actually working on now, is aging, which has a very important bioethics dimension about what we do with an aging population, and which affects not only the dignity of life and the dignity of death, but also is critically important to the well-being of populations, because we have to think about providing health care, social security, and a good life as we age, which is critically important. For some of us in the room, it's becoming ever more important. And that was also left out. So the United Nations is now forming what is called the Sustainable Development Agenda, SDGs. And I had the rare privilege of spending a whole weekend with Ban Ki-moon, the head of the United Nations, discussing what the SDGs might be. And none of us quite know what they will be. And even more to the point, there is great uncertainty about whether or not the SDGs will include a health-specific component. And the health community around the world is bitterly divided about this, bitterly divided. The World Health Organization would like to have universal health coverage as the single health-related SDG. The Bill and Melinda Gates Foundation are appalled at that notion because they think it's not measurable, and they would much prefer to have child and maternal health. And Jeffrey Sachs, who's advising Ban Ki-moon and has been very involved in sustainable health for many years, is interested in a healthy life spectrum, which is something that I would support myself. But it's very uncertain what will actually happen. The Rio +20 agenda, which really launched the SDG process, also added aging as a particular focus, as is climate change, extreme poverty, and a number of other areas. So with that in mind, let me talk about what I believe to be the answer to the first question, which is, what would global health look like? I've spent most of my years, my working years, as I've indicated, and as Dr. Cordero has suggested, in population health. And I've been stunned at how little the global health community understands public health. They've not been trained in it, they're not influenced by it, and they tend to really think that public health is all about not only health care, but specific diseases. So the whole, not the entire, but a very substantial part of the global health architecture is devoted to a few small but very important issues. AIDS, tuberculosis, and malaria in particular. The Global Fund is devoted to that. UNITAD is devoted to that. UNAIDS is devoted to that. The World Health Organization budget reflects that. And so what we see is addressing the treatment needs of a few diseases, but not a great vision of what it takes to be a population, to have a healthy population. And so let me talk a little bit about the three essential conditions that make populations healthy, ones that all of you will know, and certainly all in the School of Public Health will know. So the first one is indeed universal access to affordable health care services, particularly primary care, the well-being and the health of the mother giving birth, and the child or infant, critically important, and an entire range of essential medicines. So universal health coverage is indeed the first part of the equation. But people in public health understand that access to medical care is only a very small part of what it takes to make a population healthy. Which leads me to the second essential condition for health, which is what I would call the prevention population-based approach. This is something that doesn't wait until somebody is injured or has a disease and then treats them, but tries to prevent the disease or the injury well upstream in the lifespan. Through physical activity, diet, tobacco reduction, alcohol reduction, and beyond that, you talked about John Snow. One might also talk about Shattuck or Chadwick or Virchow, the great European and North American sanitarians at the turn of the century, and really back to the late 19th century. And they had a realization that really changed everything. They realized that a healthy living environment, sanitation, clean air, nutritious food, the abatement of vectors of disease were critically important, as well as safe workplaces. And so they recalled in horror at the squalor and the poverty and the unsafe, hazardous conditions of the Industrial Revolution. And what they did was engage in a broad movement to improve the sanitation. And sanitation, really, the sanitary era and that public health era, is what makes a population healthy. And much of the strides we've made in health and longevity were made through that fate. And yet, that is nowhere to be seen in the global health agenda, almost nowhere to be seen. And then the third thing that it takes to make a population healthy really is well outside the health sector entirely. And those are the social determinants of health, the socioeconomic determinants of health. Their education, employment, income support, racial and gender equality and empowerment, and many other areas that are critically important to the health of the community, but outside of the health sector. I'm often asked, if you could do one thing in the world to improve the health of the population, what would it be? What do you think? For me, the answer is very easy, very easy. Educate women. Because women are the gateway to health for the family and the community. And if you empower women and you educate women, they will make sure that their families are healthy. I'm a dad. Dads don't do that as well. And so those are the three conditions for health. But I'm going to focus mostly on the first two, even though the third may be the most important, because the first two come within the health sector. And so the question then becomes, if you were going to organize the global health enterprise and the architecture in a way that maximized health, what would you do? Well, this was the final chapter of my book, and I was struggling with it. And I came back one time from actually Kampala, but it could have been any large, traditional sub-Saharan African city. And the answer just hit me so clearly. Because I came back and I was just feeling unwell, a little bit the way I felt when I just got back from China a few days ago. I couldn't breathe. I was wheezing because I was behind belching diesel trucks. I couldn't use the water because it was contaminated. The food was unsafe. I just felt unwell. And yet, when I come to San Juan, or I'm in New York, or London, or Stockholm, or any of these other cities, or Melbourne, I feel good. Why? And so, in the last chapter of my book, I posit a Rawlsian thought experiment. Now, how many of you know John Rawls? I know you will, Jorge. How many of you know John Rawls? Not a lot of hands have gone up, but some. John Rawls was probably the most prominent philosopher of the early 20th century. He's not alive now, but he was from Harvard. And so powerful is his influence that in most places in Europe and North America, even today, philosophy departments are either pro-Rawlsian or anti-Rawlsian. But he had a theory of justice. And I want to, that involved the thought experiment that I would like to do with you today, if I may. So his thought experiment was as follows. If you wanted to know what justice is, the way you would know is through a veil of ignorance. So you would have to suspend your understanding of who you are and what your background is. So imagine for the moment, if you can close your eyes and imagine it, that you don't know what class you are, that you may be extremely poor or rich, and you don't know what race you are, or whether you're a male or a female. And you don't know if you're living in San Juan or Kampala or Beijing or Delhi. You don't know if you're healthy or you're sick or you're able-bodied or you're disabled. So you're in a complete veil of ignorance. And knowing that, I want to give you, or not knowing that, I want to give you two stark choices. And you can only choose one of them. So the first choice you can have is all of the medical care you could ever want. You could see a doctor anytime. You could get any medical care, even the most advanced genetically based cancer drug. You could get surgery from the finest surgeons. Literally any medical wish that you would want would be granted to you. And that's your first option. Your second option is that you would have to completely forego it and never see a doctor again in your whole life. Scary. But you would wake up every morning and you would turn on the tap and there would be clean water. You would go to the toilet and there would be a flushing toilet. You would walk outside and you would not be attacked by malarial or dengue infected mosquitoes or bubonic rats. You would be able to eat nutritious food. You wouldn't be assaulted by advertisements about tobacco and alcohol. The streets were conducive to physical activity and walking and bicycling. Okay, I can stop talking. I think you get the idea. So the first one is the way we organize global health today. The second one is the public health approach. How many would choose option number one? Usually there's one or two hands that go up only, but then they misunderstand because they don't put themselves in a veil of ignorance. Who would do two? Everyone. And every audience I talk to, it's so clear and so intuitive, and yet has almost nothing to do with the way we organize global health. Almost nothing. The Gavi Alliance, UNITAD, the Global Fund, the Bill and Melinda Gates Foundation, the World Health Organization, none of them are focused on these areas. And yet, if you go to most low and middle income countries in deep rural areas or inner cities, option number two is just not available. And we do nothing about it, but we give them high-end, expensive antiretroviral drugs. And of course, AIDS is very important, and AIDS was one of my great passions, and still is my great passion. In fact, Harvard University Press thinks my AIDS chapter is the best in the book. But actually, in the AIDS chapter, It is the best because I simply marvel at the fact at what progress we've made in AIDS. It's just astounding. I was at the very beginning of the AIDS movement, literally the very beginning. Jonathan Mann, who is the hero of the health and human rights movement and the head of the global program on AIDS at WHO, the very first one, was a very dear and close friend of mine, and we were both professors at Harvard together. At that time, AIDS seemed hopeless, and it was such a complex disease. And now we have antiretroviral medications that not only can pretty well manage and treat the disease, but also can lower viral load, preventing transmission. We've got pre-exposure prophylaxis to HIV. And yet, I marvel, why have we been unable to make any progress in mental health, for example, where we're still using horrible medications that cause tardive dyskinesia, or even the newer antipsychotics that cause obesity and diabetes and horrible side effects? Why haven't we been able to do anything with injuries? And so the answer to question number one, what would global health look like, is universal health coverage, the public health population approach, and socioeconomic determinants of health. And as a health community, our priority should be on the population-based approach, I think, to me, self-evidently. And yet it's exactly the opposite of what we actually do. So the second question is, how would you achieve global health with justice? Now, this is something that has really interested me, because I've been working around the world with civil society, but I also work with the WHO, NIH, USAID, a whole range of the kind of tradition, the Bill and Melinda Gates Foundation, all of the key drivers of global health. And when I talk to these two different audiences, I get completely two different visions of how well we're doing in global health. Completely different visions. If you talk to the UN, WHO, the Gates Foundation, USAID, or any of the others, they will say what enormous progress we've made in global health. Longevity has gone up and life expectancy has gone up. Child maternal morbidity has gone down, something that you work on, Fernando. And many other AIDS, many people, many millions of people in treatment, all of these success stories. And then I talk to people in civil society, and they are completely depressed. They think there's been no progress. Why? The why is justice. Because the great policy people think about progress in terms of overall reduction in morbidity and premature mortality, whereas civil society looks at the equitable distribution of good health. And the truth is that the gap, the health gap, between the rich and the poor have barely shifted. All of the gains have been made in middle and higher income groups, and very few of them in very poor groups. And so the question is, not only how do you achieve global health, but how do you do it with justice? So the first thing about global justice, of course, or any justice, is that it tends to be very political. In the United States, for example, actually all over the world, and you will know this, probably the biggest political fight is over economic fairness at the moment. But it's a political fight because it involves the redistribution of wealth, and that's always very controversial. But one thing that I realized was that the public health approach that I just mentioned is particularly wonderful because it doesn't necessarily even require redistribution because it embeds justice in the environment. If you have no malarial mosquitoes, they won't bite the poor or the rich. If all the taps are clean, everybody turns on their taps. If you've got flushable toilets, everybody has that. If you've got clean air, we all breathe the same air. And so one of the wonderful things about public health is that done right, it can embed justice in the environment. If there is that, you come a long way toward justice, but it's not enough. You have to do two other things. One is that you have to dismantle barriers to access to these public goods. Barriers that may be caused by disability, living in a rural area, extreme poverty, and the like, so that people can have access to these goods. And then secondly, you do need a certain amount of redistribution of public goods, including income. And so the answer to the second question of global health with justice is, one, that you embed justice in the environment, two, that you reduce and dismantle the barriers to access to these public goods, and three, that you do need a certain amount of redistribution. So finally, how would we get to global health with justice? And that's a really, really hard thing. When about 5 years ago, I wrote an article that was towards a framework convention on global health. And what the Framework Convention on Global Health tries to do is exactly what I've just talked about. It prioritizes public health, it has redistribution, but it also talks about good governance, which is so absent in so many parts of the world. Good governance is honesty, no corruption.
What's that?
What is that?
That doesn't happen here.
Doesn't exist.
No, not at all.
But just the fact that you resonated so strongly to that comment shows how important it is to you. And it is very important. And there are some places in the world where it's just ridiculous and impossible. Good governance is transparency. It's setting targets. It's monitoring progress. It's accountability for results. It's civil society engagement and openness. All of these things are hallmarks of good governance, and they are essential to good global health. And so the Framework Convention on Global Health tries to do this. And I don't have enough time today to really go into the Framework Convention idea. It has had a lot of traction. Ban Ki-moon has endorsed it. Michel Sidibe, the head of UNAIDS, has endorsed it. There's now a big civil society campaign called the International Campaign for a Framework Convention on Global Health, which is fighting for it. Even Margaret Chan at the World Health Organization doesn't believe in a framework convention on global health, that is international law, but she would like to have a soft framework for global health. At the WHO, they call it GOSTIN Light. And so, will this ever happen? I don't know. What I do know is that it's already changed the conversation, that everywhere in the world I go, I've just been to China, they know about it. It's something that is on people's mind, and it's bringing the population-based approach, the human rights and the right to health approach, and the idea of justice to the forefront in the global health discussion. So I have great pride in the fact that the conversation around the world is changing. But will it ever happen? Well, some days I get up in the morning and I am full of excitement and enthusiasm, And I really, really think it's going to happen. And some days I wake up and I am so defeated, so distressed, and I think it is completely hopeless. Unfortunately, there are more of the hopeless days these days, but I refuse to give up. And to your students, and when I talk to students, I say, don't give up. I remember in Beijing, I gave a lecture, and one student just said, well, we can't change Beijing. We can't. It's impossible. And you just have to say, you can do it, and we have to make the future generation responsible for doing it. And that's what we're all educators. That's what we're here to inspire the young people to take this mantle of global health with justice and to make it a realization. So that's really all I wanted to say. I wanted to give you my imagination of what global health and justice would look like. This is a perfect place to do this in a school of medicine, public health, dentistry, law, and the like. We can make a difference. And if we all pull together, it is a great honor to be here. I love this island, I love this people, and my wife and I feel very fortunate to be here. So thank you very much, and I'll be happy to answer questions.